Hello, I'm Kelly Janis, a recent graduate of Cleveland State University School of Nursing in the MSN track with forensic specialization. My co-author of the Barriers to Risk Education for Obstetric Nurses is Dr. Kimberly Cleveland, tandem member and academic affiliate of Kent State University. Throughout my 3 years as a high-risk labor and delivery nurse, I have gained an increasing curiosity of obstetrical litigation and its impact on nurses working in the specialty. Obstetric nurses perform sophisticated care within a complex clinical environment which poses vulnerabilities to litigatory exposure. Nurses must interpret and act on electronic fetal monitoring, assist in vaginal and cesarean deliveries, administer several high-risk medications, and maintain competency in maternal fetal neonatal resuscitation. The two main questions that guided the purpose of this educational project were 1. Do nurses possess the knowledge to aid himself or herself in the role of deponent and/or defendant? And 2, are there any gaps in the literature regarding obstetrical litigation as it relates to nurses? The goal of the education program was to expand the knowledge base of obstetric nurses regarding litigation. This was implemented in several ways, including exploration of strategies used to mitigate litigatory risk, review of obstetric medical malpractice claims, explanation of relevant legal terminology in the deposition process, identification of available organization-based resources, and emphasis on professional nursing organization involvement. I was fortunate enough to gain consent to conduct my project at my home hospital, which is University Hospital's McDonald Women's Hospital in Cleveland, Ohio. There are roughly 4,000 deliveries performed each year at this Level 4 perinatal center. My target population consisted of obstetric nurses, including high-risk labor and delivery nurses, as well as perinatal float pool nurses. An email was sent to the target population to include an introduction to the project, pretest, educational module, and post-test. The pretest and post-test were created utilizing Qualtrics to ascertain a baseline knowledge of the obstetric nurses. Qualitative data was gathered from questions consisting of multiple choice, short response, and Likert scale. Obstetric nurses were given the opportunity to receive 1 hour of continuing education upon successful completion of all components of the education project, including an evaluation. Data review was performed using Likert scale analysis, SWOT analysis, comparison of pretest versus post-test scores, and participant feedback provided via the evaluation forms. The charts displayed contrast pretest versus post-test data submitted by participants in the education program. The data shown is participants identifying his or her level of confidence in 5 main areas: deposition preparation, medical malpractice, closed claims data, legal terminology, and protective factors against poor litigation outcomes. In the pretest, data was distributed in an arguably more symmetric fashion, with participants giving a range of responses from strongly disagree, neutral, and agree in their confidence level of the 5 topics. Post-test data is skewed to the left, where participants felt a neutrality or an agreement to the statement, "I feel confident in my knowledge base regarding the topics discussed previously." Post-test data indicated an improvement in participants' reflection of his or her knowledge base after the educational module regarding legal terminology and in protective factors against poor litigation outcomes. Participant knowledge was demonstrated to be enhanced by the educational module in the following areas: drivers of litigatory risk, application of Newman systems knowledge of the role of the obstetric nurse, the protective role of nursing resilience, and components of a deposition. Participant knowledge was not found to be enhanced by the educational module in the following areas: application of involvement in professional nursing organizations, and understanding of both plaintiff and defense attorney goals in the setting of deposition. There were a few takeaways from the design, implementation, and evaluation of this educational program. Participation was a challenge throughout the implementation of the project. The small sample size posed difficulty in the generalizability of the results. Considerations include the use of a learner assessment survey and incorporation of case studies. Nursing insurance is a topic that was not explored during the project. However, insurance and indemnity were mentioned several times throughout the literature. Several questions arose through the design and implementation of the project. What barriers impact project participation? Did COVID-19 have an impact on participation? Does nursing insurance pose a benefit to obstetric nurses? What is the knowledge base of nurses regarding nursing insurance? Could insurance premiums drop with increased participation of obstetric nurses acquiring insurance? Do obstetric nurses feel threatened by litigation? And do legal consequences play a role in nurses leaving the bedside? Again, my name is Kelly Janis. Thank you for listening.